welcome everyone to our Faces and Places of Peer Support series. This is a series that we're doing through the virtual community of practice as part of the Academy of Peer Services. What our hope is to really highlight and recognize best practices in peer support, and we are really delighted to welcome Joe Swinford with the Wellness Collaborative New York, which is an independent practice association. Many of you may know Joe from his prior role with the Office of Mental Health, Deputy Director of Office of Consumer Affairs, and I think he's embarking on a brand new chapter of his life, which is an exciting one, and we're just happy to have him join us. Joe?
Thanks, Rita, and it is sort of a new chapter not only for my life, but for peer services. And I'll talk just briefly for a moment about what an IPA is, but we are, as far as I know, the only independent practice association for peer-run agencies in the country, certainly the only one in New York State. Many of you may be getting services from an independent practice association and not really know it. By that I mean that these have been around for many years. In some ways, it's a business arrangement that allows medical practices or healthcare practices to come together to have folks mute that aren't Wait, I'm getting a lot of echo. I'm not from where.
Yeah, I'm sure I muted everybody that I can.
Okay, so I'll go ahead and we'll work over the top of the background noise, but if you're not speaking, please mute your line because that background noise is quite annoying. As I said, we are the only independent practice association for peer-run programs, and an independent practice association primarily is a group of medical or healthcare practices that, while they retain their independent agency status, they come together to collaborate, to work together, and to contract together for services. And so we were encouraged by OMH a number of years ago to begin looking at how, as we moved into managed care, the peer-run agencies could increase their viability. By that I mean not be isolated agencies here and there across the state, but to have a coordinated single presence. And an IPA allows us to do that without getting into some of the legal issues around price fixing and collaboration and collusion and all that kind of good stuff. So it gives us a legal entity, which we have named the Wellness Collaborative of New York State, that we hope to, and you can see some of our goals here, develop and nurture the collaboration and share our strengths with each other. Our peer agencies across the state have a long history of strengths in various areas, and so when we come together, we want to be able to learn from each other and to draw from each other's strengths so that we're providing quality peer services across the state. We certainly want to try and expand peer services, which expands the ability for peers to find employment, and we want to increase the quality of those services. We focus our services on ones that we have an evidence-based practice to focus on. We use some tools that help promote the fidelity and improved quality, which gives us the opportunity to have better outcomes across our agencies when we're providing peer support, not just to through managed care agencies, but in other arenas as well, where we're talking about value-based payment with hospital systems and some other opportunities. So, as I've said, we are unique. We're accountable for our genuine and diverse peer organizations that are our members, and we also offer peer support to each other. We really do focus on SAMHSA's best practices and benchmarks, and we have adopted many of the tools, such as the Facet tool, which allows us to look at the fidelity of the service models across all of our member agencies. You see here our mission statement, and we really want to focus on eliminating disparities and marginalization for our communities. We want to develop and implement the best practices of peer support. We also want to be innovative. We certainly have a very high value on being peer-run. All of our partner agencies meet OMH's definition of a peer-run agency. We're holistic, and we do things from a trauma-informed perspective. Our membership, you can see here, it's open to any agencies that meet these guidelines. These are these are pretty basic. You have to be qualified to do business. You have to be committed to peer services. You have to be not excluded from Medicare or Medicaid. If you're going to be providing services that require licenses, you have to have those. You have to be financially solvent and not engaged in anything illegal or fraudulent. And you have to agree in writing to be bound by not only our corporate bylaws, but our code of ethics that we've adopted for our corporation. So all of our partner agencies adhere to a single code of ethics and standard for the way we provide services. So who are we? You can see here logos for our partner agencies. These are the primary partners. These are the full partners that have joined. We certainly are open to others who may be interested in joining us either at this level, the full partnership level. MAHEP is currently the managing partner amongst all these agencies, but all these agencies are represented on our board of directors and have votes in things we undertake. We have affiliate agencies. These members are not voting partner members, but they are affiliates. They do agree to be a part of what we do. Many of them will gain, as we gain ability to get new contracts, they will be able to take part in that, but certainly they gain from the experience and the technical support that is provided across all of our peer support agencies. And so whether your agency might be interested in being a partner, or maybe you're not you're a program under a larger agency and you're interested in being an affiliate, we'd certainly be glad to discuss that with you. Currently, we're in 40 of the 62 counties in New York State, so we've got quite a bit of coverage across the state. You can see our map here on the screen. We're pretty heavily covered in western New York and the Hudson Valley down towards the city and Long Island. Not as much in central and certainly up towards the North Country, although we have good coverage up in sort of the heart of the North Country, up in St. Lawrence and Franklin County. But we also, if you compare this with the list of OMH's peer-run programs, you can see that where we're sparse, the number of peer-run programs are kind of sparse too. So we're always continuing to work increasing this coverage area, but I think for the group's been incorporated for approximately a little less than a year, about 10 months, and for essentially 10 months of operation, I think covering 40 counties out of 62 is a pretty good outcome so far. We're focused on 3 service models, and these are models that we can replicate across all of our member agencies, though some of our agencies are more expertise in one service area or the other, and if one agency is more of an expert in an area, we look to them to help others that are trying to develop those services. So we do transitional services, which are where we have certified peer specialists that work helping people transition into the community. Maybe these are folks who have been long-term or even shorter-term in an institutional setting, forensic setting, or maybe they've been homeless, and we're trying to help move those. So this is a lot of what people think of as sort of the traditional peer support, peer-to-peer, helping people develop their place in the community and develop their social capital. We also focus on crisis diversion, and that is a broad category that includes not just respite houses, but peer support lines, diversion from emergency rooms, and we've got some new and exciting things we're talking about with some of the managed care companies in the crisis diversion area, as well as some new technology that hopefully this fall you'll begin to be hearing more and more about, which will allow us to do more in this area than we've done in the past. And then finally is the wellness coaching. This is where we're looking at peer support, again, with certified peer specialists that provide that whole health approach from the 8 dimensions of wellness that SAMHSA has put out to try and help people develop a healthy life, both integrating their physical and mental health needs to really become a productive member of the community. Now, I've talked a lot about what we provide service-wise to, our members provide to the community, but the collaborative itself, and by being a member of the collaborative, we provide services to our members. So one of the things that we provide is we'll be developing contracts for our service, for our member agencies to provide service with some of the payers, be it managed care plans, hospital systems, and the like. So they are able to get new funding streams through being a member, but also they get workforce development tools. We have a vast library of job descriptions and practice guidelines, codes of ethics, and things of that nature. By being a part of MHEP also manages the certification board, so it allows us to work closely with them as they develop, say, additional continuing ed programs and things of that nature. We are currently using a SAMHSA grant so that all of our member agencies are able to get program reviews under that grant. We're developing an evaluation toolkit that SAMHSA has, so we're rolling it out so that we can have a quality standard for services across all the agencies. We provide training. We've done a lot of training around intentional peer support, trauma-informed approaches. We just recently supported a forensic peer specialist training down in Westchester, and I believe coming up sort of the second phase of that training will be for trainers to do that, and this is based on SAMHSA's standard for forensic peer specialists. All of the things we do help people meet the certification requirements for peer specialists for their workforce. Again, we look to develop even more service models, and we help our programs develop a lot of what is sometimes missing for small agencies, things like corporate compliance, the ability to do Medicaid billing or have qualified healthcare professionals to help you with if, for example, a managed care company wants that type of sign-off in your program, we're able to help make sure that our members all have that, as well as standardized policies and procedures. So a lot of that back office function that is kind of pricey if you're trying to do it as a small agency, but when you share it as a collaborative, then it becomes a little bit easier to swallow. And so that's what we do in order to provide services to our members, and that list will continue to grow, obviously. We have worked on a number of projects since becoming incorporated last year, and you can see this list here. Many of these are ones I've already talked about. We do have a slate of officers for our board of directors. We also are keeping up on our audit, our finance, all of those due diligence for our business arrangements. And we are currently in discussion, as I spoke of earlier, with MCOs as well as some of the other value-based payment groups around the state about developing new lines of business for peer support. There's a lot of interest out there, but a lot of them don't quite know, A, how to go about purchasing it, and B, how to make sure they're purchasing good quality. And so we're trying to help make sure that we can help them by providing them a good quality service and at a fair price. And so we're having a number of discussions with several of the managed care companies in that regard. So with that, Rita, that kind of lays a groundwork. I'm going to bring up here in just a minute, and I'll share our website. It is not. It's not the. It's kind of a basic website at the moment. I've only been in this position since the 1st of June, so I'm trying to develop that website to be a little more interactive, but we'll bring it up here on the screen in just a moment. So, Rita? Did we lose Rita?
Nope, I'm here. Sorry, I was on mute. I was trying to find the unmute button. Thank you, Joe. That was a great overview, and I already have one question. I would like to open it up for questions from everybody else, and we'll start with the chat. And then as we run through the questions, we may start to unmute some of the lines. It gets a little bit noisy when we do that. So let's start with the questions in the chat. We have one from Stephen who says, thank you, Joe. What are some of the more holistic and less mainstream methods and solutions that are practiced within the peer crisis diversion, traditional services, and wellness coaching lines?
Well, I think most everything we do, we try to make sure we are innovative in the way we do that. Most of the transitional work would be similar to, say, what you would see with peer bridgers. Obviously, we have the folks at People, I'm going to call them People Inc., but People USA. So we promote the use of the crisis respite programs and so that living room model that is promoted by Rose House. Wellness coaching is probably one of the ones where we have some of the most innovative things going on, and Baltic Street is one of our major providers of those services down in New York City, and they have done a lot of work with Peggy Schwarbrick out of New Jersey in trying to really help their peer specialists understand that 8 dimensions of wellness and how to help someone develop a wellness plan so that they are not just focusing on being a mental health patient, but being a healthy person as a member of the community.
Great, Joe. Thanks. I don't have any other questions at the moment, but in the chat. But I was just curious as far as if people had a recommendation for a service that might be considered by the Independent Practice Association, could they just reach out to you and have a conversation?
Absolutely. They can reach out to me at any time. My email is jswinford, SWINFORD, @mehepinc.org. So it's a pretty simple email. They can reach out to me with any questions or any recommendations. And I will say our member agencies provide a wide array of services beyond just these 3 replicable models that we focus on, because all of our member agencies still retain their independent status. They are all still functioning as they have before. This is a way for them to collaborate and create new business and improve the current business they're doing. So we have a lot of agencies that are providing a lot of different programs that may not show up here, but certainly we would be very interested in things that maybe we aren't currently doing or that maybe we are doing but we'd like to do more of.
Very good. Also had a question, how would a provider for the IPA, what would be the process for doing?
If somebody's looking to join the IPA?
Yeah.
The first step would be for them to contact me. Then we have a sort of survey process. I would go out, I would meet with the provider agency. We would talk through some of the things that we look for in their programming and their standards. We have an official application form that we would fill out at that time, and then we would bring that back to our partner board, the 10-member partners, who would then review and approve that application. So it's not a quick process, but it's not a drawn-out process either. We've had, in the last 6 months, I think we've had 2 or 3 new affiliates come on. So it doesn't take a long time if everybody is wanting to move forward. So, but we do make sure that we meet with the agency. We make sure that there's an understanding and a sort of relationship that we feel we can develop between the IPA current members and new members or new affiliates, and then we go from there about whether to bring that on.
Thanks, Joe. And another question that came up was, is there any plan or vision for working with other types of IPAs, so like IPAs in other disciplines like behavioral health organizations?
We've had some discussion about that. I'll be honest with you, the IPA has been focused mostly for the last couple of years in their existence of building their infrastructure, getting their own business house in order, their incorporation, their 501c3 status and things of that nature, and focusing on our core services. But we've also talked about and looked at opportunities for collaboration. We have to be cautious in some of that. Some of that is guided by just the state regs and laws around how IPAs can work together. But certainly we've looked at, particularly as you think about the big buzzword of value-based payments, where these large organizations come together and form these community collaboratives, and how we can work with them. One of the big concerns, obviously, is that you don't want these traditional clinic-based or hospital-based provider organizations just deciding, oh, we need peer services, so we're going to create them and build them in-house. Our message to them is, there's some unique infrastructure for supporting peers that are working on your staff that you probably haven't even thought about, and we've developed within our agencies, and it's probably better for you if you buy it from us, and we'll subcontract to you to provide peer support for your members, as opposed to trying to build it in-house when we've already been there and done that. We've got the workforce, we've got the infrastructure that people would have to build from scratch and face all the challenges that come with that. So we are looking at that, but again, we go cautiously in expansion because we want to make sure we provide a quality product, not just large quantity.
Thank you. Very smart. Another question that came up is whether the IPA might be interested in partnering with the family peer advocates and youth peer advocates.
We've actually had some discussion with the family peer advocate programs as they've moved into managed care with the children's waiver coming online. And so we've been having some discussions with them and their state group to get where they come together about possible collaboration and how we can work together, how maybe they could become part of our organization. We're in the initial phases of that. We've met with I would say probably the majority of those organizations, their leadership were at the Families Together conference, and so that was an opportunity for us to meet, have an initial discussion, and so they're going back and chewing on what we've talked about, and we're doing the same. And so I use the analogy of it's sort of like dating. We've had our initial go out and have coffee together. We've agreed to come up with sort of second dates and where we might go, but we're sort of at that stage of developing the relationship.
Great. And sort of a not exactly related, but a tangent topic, because there's been so much confusion between the certified recovery advocates in the substance use field versus the certified peer specialists in the mental health field, and certification is only one avenue towards becoming peer specialists. But have there been any discussions with the substance use community and the OASIS side of things?
Before I came, we had some interest expressed from the substance abuse community about learning more about it. I'll be honest with you, just like adding children and families, we're currently a group of folks that have come together that are adult peer support in the mental health world. We don't want to lose our values. We don't want to. We want to maintain the integrity of peer support and what we provide, and so we don't want to dilute that. At the same time, we don't want to say no to that, to those other agencies, and so we haven't had the level of discussion with substance use agencies, and to be honest, I'm not sure there's that many of peer-run agencies, pure peer-run on that side as there are on our side, but they have expressed through their, what is it they call it, their recovery implementation team. There's been some of the folks that come to that that have expressed some desire to learn more about what we do, and maybe there'll be some opportunities there. But we go cautiously in those types of things because, again, we're focused on maintaining a quality product and maintaining the integrity of what we do. That's really our core of kind of what drives our business decisions.
And so recruiting peer specialists or peer, either certified peer specialists or peer workers for each of the independent organizations, has there been any change in that since the IPA has formed, now that you're developing quality standards and things that go along with that?
No, I think all of our agencies are still using their recruiting tools that they've had because they've built their agencies over the years based on that. We do probably have a little bit more ability to share with each other, and so a lot of times newer agencies will say, hey, I'm looking at bringing on a crisis diversion person. I haven't done this before, so they'll come to the members and come to our library and get job descriptions and things like that to help them sort of tease out what they want to, what they're looking for in a person. We also have some standards that our partners try to adhere to as far as how quickly we look to get people that we may hire that aren't certified, to get them through the process and get them certified so that we can get the majority of our workforce certified. But again, remember, not all of our business requires a person to be certified. That doesn't mean that we don't try to encourage our employees to reach that level. Even if we're doing business that doesn't require it, we still feel it's a good standard. And so in order to promote a better workforce among our member agencies, we push for that, and we have some policies and procedures we follow across all of our member agencies around that.
Okay, Joe. Well, do you have anything else that you'd like to add? Because what I'm going to ask everybody on the call right now to do is to mute your phone at your end if you have the ability to mute your phone or the ability to mute yourself. I'd like to ask everybody to mute yourself unless you have a question to ask. And I'm going to unmute all of the lines, and hopefully this will work, that it won't be and then we can see if anybody has questions that they want to ask, and if we are too noisy or just really can't hear anything, I'll just mute everybody again. But I'm going to count to 10, and at the end of 10, I'm going to unmute the lines. And if anybody has any questions, and Joe, if you can think of anything else you want to add during that time, we'll add it at the end.
Okay.
10, 9, 8, 7. So you should be muting your line unless you have a question. 6, 5, 4, 3, 2, 1. Okay, everybody's unmuted.
And let the bedlam begin.
Okay. Does anybody have a question for Joe?
Drake here. I have a question.
I didn't know there was such thing as girl colors.
Anybody?
Hello, did you have a question for Joe?
Rita, are you talking to me?
Yep.
Yeah.
Yeah.
So, love everything you're doing. So,
I have a mic, sir.
say, so I work for a residential provider as of here, and I'm the only one here, and could totally use additional support in those areas that are unique to peerness. So if I wanted to, say, encourage my employer to contact you guys for whether it's partnerships or guidance, how would you suggest I go about doing that?
Well, I think the best person to contact would be for them to contact me, and then we can see where we can go with that. Your point about being the single peer in a bigger agency like a residential agency does point to something I didn't mention, and that is we are working, and we try to do more with what Rita's doing through the IPA in developing ways to support those peers that are in non-traditional agencies, and that's where our affiliate membership is very, very helpful, because it does allow those agencies not to have to function at a full partner level, but still get things like that kind of support for their staff out of being affiliated with the IPA.
Thank you.
Mm-hmm.
Oh, sorry about that. I was talking and I was on mute. Sorry. We have a couple more questions in the chat. One is, can a clinical provider who also provides peer services join the IPA, or in the cases of what you mentioned, the affiliation group?
That would probably be more of an affiliate member status, because to be a full partner, you do have to qualify as a peer-run agency, which means your governing body has to be predominantly peers. So, but certainly we could talk about that affiliate status, and that gives a lot of the same benefits, though there are additional ones on top of that for our partners.
And can individual peer specialists contribute or participate in any way?
There's not a membership for individuals, primarily because we don't have an individual practitioner ability for people that are peer specialists. So unlike a medical practitioner, a peer specialist can't just up and operate their own business. So we really don't have a category of membership for individual peers, but we do have for their agencies. And so if an individual is interested, I would encourage you to have the agency contact us. That said, we offer trainings and things that sometimes are open, particularly if we have additional slots beyond just our members and affiliates. And so you could kind of keep an eye on where we may offer a wider opportunity for things. And if we open it up to the broader community, certainly you'd be welcome to come and participate in that.
Excellent. And I actually had one other thing I was thinking of while you were speaking, because up in Canada, I know they've got an innovative pilot that they're doing right now where they've worked with the funders that are funding peer services up there, where they're requiring any organization that has peer services to create a community of practice within that organization, so that the peers have group supervision capability, because the supervision has been so poor across the board, not poor across the board, but not consistent across the board, and especially when it's been clinical supervision, there's not always been an understanding of what peer support is. So because there's been a lack of understanding of the peer role, what they're looking for are ways to increase that supervision layer within organizations, and they're using the funding lever as saying you won't get funded for your peer programs unless you do this to help create supervision. Is that something that the IPA can start beginning to work on here? Because I know it's an issue across the board, but in the states here, and especially I think there's areas in New York where that's true, especially with single peers and things.
Yeah, we've actually had some initial discussions with and made some proposals to OMH about doing some things that might help in that regard, because the issue exists here. Certainly for our member agencies and our affiliates, we have a little better sort of captive audience for making that happen. But we're also looking at ways that we can use our member agencies as concrete examples of how things should be done, and then through other means, maybe providing technical assistance to those who, for whatever the reason, they decide to build it, not buy it from us, that we can provide some technical assistance without sort of going in and helping what in a business sense may be our competitor learn all our trade secrets. So, we're looking at how we can do this in a way that makes sense both from a business standpoint as well as from our sort of give back to the community and our ability to try and leverage what we're doing to help improve overall the practice of peer support.
Right, and I think I didn't mention the part that I was thinking about when I launched into that earlier conversation, but one of your member organizations is not just contracting peer support, but also contracting supervision. So that the supervision of peers, so that it's a peer supervisor, who has the peer support experience, and that kind of contracting can be a tremendous asset for an organization that doesn't have that kind of supervision within their organization currently.
Yeah,
and it's hard to grow it.
We're encouraging more of that.
Yeah, yeah. I see so many benefits to this whole, just the whole practice association. I'm so excited about it. I was excited the first time I heard about it. Any other questions? How to encourage employers with minimal experience providing peer support service? I think that was the question. Mm-hmm. Oh, and I just got a note from the person who's doing the supervision program, and she said it's going great. So yeah, thank you.
Good to have a testimony.
And then somebody else said, could we hear more about how that contracted peer supervision works? Joe, if you want to talk to that, you can. I can also unmute the person who's doing it if you want as well.
I think we'll let the folks that are doing it. I try not to sort of usurp our members in what they're doing, but just sort of way of introduction. We really have encouraged agencies that are not used to providing peers to find some way to partner with us, whether it be contracting for the whole shebang of all the peer services, or like this with contracting just to help with the supervision and the folks retain the employees on their end. So we are always looking at innovative ways to do it. So since we have that person on the call, I'd rather let them speak to exactly what they're doing.
I just sent her a note saying, is it okay to unmute her? So I'm unmuting her, and if she chooses to talk, she can. Okay, you're unmuted.
Hi, Joe. This is Kristen from Housing Options.
I thought that's who it probably was.
So we have, they're both recently started, but we have with two separate agencies, peers that we're working with. So I provide supervision to peer staff in these two agencies. So that's, weekly meeting just to check in, provide peer support, provide peer supervision, talk about any issues that they may be having in the roles that they're doing, and then how to provide tools that they may need in the field that they're in to, better support the peers that they're working with. And then monthly, teams workshops and trainings so that there's an ongoing level of training in regards to peer services that those guys have. And then, certainly I'm always a resource for them. So we have, very consistent supervision with them. And so far, both programs are going just fantastic.
Thanks so much, Kirsten.
And that is what was sort of anticipated or envisioned when the HCBS services when that manual was put together about how supervision should work, was that if you're not an experienced peer program, you don't have folks who really understand peer support on staff to provide supervision, that you would turn to someone who does have that and bring them in on a consulting basis like this. And so I'm glad to see we're able to give some concrete examples of that.
I would also say that the really neat thing that happened with the one agency almost immediately is that our peers who we give a lot of training to on strength-based language and motivational interviewing, the teams that they're working with, so they're all part of integrated teams. Those teams came back to us and asked, can you give us just some of that knowledge and education so that we can work better with the peers that are working with us. So they really wanted to learn as much as they could so that they could have really great experiences working with the peers on their team, and I thought that was really nice too.
Excellent.
Awesome.
Well, Joe, do you have any last minute? I did mean to mention at the beginning, but I'll mention it at the end, that our Faces and Places series is really designed to be a lunch and learn, so it's a 45-minute webinar, something that's usually pretty quick. But I am able to hang out on the line for a little bit afterwards to take any questions and forward them on to Joe for answers. But in lieu of that, I'd like to just say thank you, Joe, if you have any last-minute things to mention or say or anything that you want to add.
No, just continue to look to our website for new things coming up, and any questions or anything that may come up, just feel free to shoot me an email. Again, that is Swinford at MHEP, all one word, .org.
Thank you, Joe, and thank